There's no question that heart health in men and women has been different, and clearly for women, greatly a disservice has been performed because they've been underdiagnosed. Traditionally for bypass surgery, it was young men in their 40s that are having heart attacks, and that was a big deal.
The model that we had for many, many years was the male model of disease, and that really led to a misperception that heart disease was a man's disease. But really what we understand now is that it's an everyone's disease.
And paradoxically, we know that in the patient population as you age and over the age 85, women are disproportionately represented as people that have heart disease than men even. So it's an interesting phenomenon. I think we're getting better at both recognizing, diagnosing, and treating the female population.
Women oftentimes have more subtle symptoms. They're not as severe. Might not be the elephant sitting on my chest feeling. It may just be a discomfort. So typically I will not even ask, are you having chest pain? I will ask, are you having chest discomfort? Because that may elicit the correct symptoms that I need to be aware of and that I want patients and women and men to know about. Any discomfort between the jaw and the upper abdomen is fair game. And we're talking about discomfort that can be in the jaw or the neck or the chest. In women, below the breast, going to the shoulders, going down to the arms, going down to the hands, and even in between the shoulder blades. Any discomfort in that area that's either emotionally stress precipitated or precipitated by physical stress or exertion should raise concerns. Could this be my heart? There are associated symptoms that we would want everyone to know about: shortness of breath, dizziness, sweating, nausea, vomiting that can accompany the chest discomfort. And then in women, we also need to recognize that not all of the symptoms can be due to chest pain. In fact, chest pain may be absent, and the other symptoms may be predominant, such as feeling short of breath if you do your usual activities or climb stairs or walk, or feeling like you're sweaty when you normally aren't and you're not doing something so physically strenuous. So it's important to be aware of the classic symptoms, the atypical symptoms that women present with, and then the associated symptoms, because any of them can be your presentation.